So we're doing a bladder tumor resection, a transurethral bladder tumor resection. And we're going to use a new technology we call cystview, which means we're putting an agent into the bladder that is going to turn the tumors red when we shine a fluorescent light on the tumor. So it helps us detect tumor better and resect it more completely. So the patient has had multiple tumors before, and they are returning relatively rapidly and frequently. And so one of the reasons that can happen is because we don't actually see it all the first time and don't get rid of it. And so cystview can really help make sure we see everything and hopefully decreases risk of recurrence. So the cystview itself doesn't really change the procedure, the complexity, or the discomfort. We bring the patient in a little bit early, and in the preoperative holding area, the nurses will put a catheter in the bladder, and they will put this reagent cystview into the bladder, and it stays in there for about an hour. The patient then comes into the operating room, gets the anesthetic. Then we look inside the bladder with the camera, with the cystoscope. We can look around and we can flip back and forth between the regular white light, that's normal light, and the fluorescent light. It's just a switch on the camera. And so we see, first of all, usually with white light, we do a full survey of the bladder, see what we see. And then we switch to the fluorescent light, what we call blue light, and see if there's anything else that we missed, or if there are any questionable spots, we see if they light up pink or not, which would mean that they're potentially a tumor. We then resect the tumor. Whatever we see, we scrape off with a cautery loop and make sure there's no bleeding, and then we go back to the blue light and see if we maybe missed anything. So we always resect with the white light, and then we look with the blue light to see if there's anything else that we might have missed.